AFSP was created in 1987 by families who experienced a suicide loss and by researchers who felt there was very little investment in the research we needed into the causes of suicide and its prevention. Likewise, in the late 1980s, there were very few resources for the families who had lost a loved one to suicide. These enterprising researchers and families created AFSP so that there would be a sustainable resource for suicide prevention in our country, similar to what exists for cancer, heart disease, and diabetes. Throughout the 1990s, AFSP remained a small New York-based foundation that was supporting prevention research and providing support for survivors of suicide loss. Today, we are the leading national not-for-profit organization dedicated to understanding and preventing suicide through research, education, and advocacy, and to reaching out to those impacted by suicide. AFSP's long-term objective is to have a world without suicide. That's why we exist. Our current objective is to reverse the upward trend in the suicide rate that we've been experiencing for many years. We believe the best way to reverse this trend is to dramatically increase scientific research to promote policies and legislation that can advance suicide prevention at the federal, state, and local levels, and to offer educational programs for professionals and the public, especially regarding the disorders that contribute to suicide and suicide warning signs and about treatment for those at risk. For example, AFSP is now the largest private funder of suicide research, investigating the genetic, biological, and behavioral factors that contribute to suicide, and testing new interventions and treatments. Another objective is to expand support for the surviving families and friends after suicide, including increasing the number of healing conferences that take place each year as part of AFSP's International Survivors of Suicide Day, training support group facilitators, and developing outreach programs in communities across the country. The hope is to have trained volunteers who have lost a loved one available to meet with the recently bereaved, to offer information about resources, and to let them know they are not alone. We are making progress across all of these objectives, but clearly much more is needed, and we must accelerate our efforts if we are to reverse the upward trend in the suicide rate in the U.S. To say it another way, we want to make suicide prevention a national priority. AFSP is a leader in the suicide prevention field, and we are known for our reliance on science, as well as on our innovation and ability to leverage other resources. One tangible example is our research grants program. We are investing in the most promising studies that are critical for more effective prevention. Many of our funded investigators are testing innovative ideas and gathering pilot data needed to apply for larger grants from agencies like the National Institute of Mental Health. By serving as a catalyst for research into reducing suicidal behavior and suicide, AFSP is helping to shape the national research agenda and is developing the field of research by attracting the brightest minds. And we are leveraging greater resources from the federal government and other sources. This same innovative approach applies to our prevention programs. For example, there is a serious problem of suicide among college students. In response, AFSP developed an interactive screening program for use on college campuses that has been shown effective in identifying students who have problems that put them at risk for suicide, but who are also not seeking help on their own. This innovative evidence-based program has not only been effective in getting help for at-risk students, it's also leveraging additional resources for campus mental health and suicide prevention. Through the interactive screening program, AFSP is encouraging universities around the country to address the problem of college student suicide. One of the most important leverage points for AFSP is our work on creating a new level of awareness about the problem of suicide and about the need for prevention, as well as efforts to dramatically increase the numbers of people who are becoming involved in the suicide prevention movement. We are accomplishing this through creating a nationwide network of AFSP community-based chapters and by organizing Out of the Darkness walks throughout the country. The chapters in the walks are leveraging greater resources for suicide prevention and are expanding involvement in our cause by people personally affected by suicide, mental health professionals, and by business, civic, religious, and other community leaders on a scale that's never been seen before. AFSP is literally at the forefront of creating a sizable grassroots movement, or expressed another way, a growing active constituency for suicide prevention. What makes AFSP effective is that we rely on science. We are fortunate to have the best scientific minds at our disposal through a scientific advisory comprised of suicide prevention experts. Also, unlike most organizations, we have an experienced medical director on staff. Not only do we follow what the science tells us, but we pilot test and collect data on all of our programs. Therefore, everything is based on the best available evidence. We are also effective at bringing together the science and the passion that exists among people that have been personally impacted by suicide. And when you bring together this passion and the knowledge of our scientific leaders and clinical experts, you have an effective formula with resources needed to develop and implement the best prevention strategies, tactics, and programs. This makes AFSP an incredibly effective organization. Another way we are both unique and effective is through creating a locally based suicide prevention movement. We are a national organization, and nationally we provide leadership, science, and direction. However, we are also building a network of chapters all around the country. These chapters are a vehicle for raising awareness and resources and for delivering effective programs in their communities. There has never been anything like this for suicide prevention in our country. We feel this is an effective strategy because suicide prevention is not something you can just do out of a national office in Washington or New York. The delivery of effective programs must also be community-based. A third way our organization is successfully addressing the problem of suicide is through launching the Out of the Darkness walks. These walks have been shown to be effective in raising awareness in communities where they are held and also getting people from the local community involved in suicide prevention. When we started these walks, there were people who felt that no one would ever walk for suicide prevention, that there were too many walks, and that our issue was different than breast cancer or HIV/AIDS. This was back in 2004. However, there was also a belief by many of us that if we created these walks, we could break the silence around suicide, generate new resources for suicide prevention, research, and programs, and engage many more people in our cause. In fact, this is exactly what's happened with over 250 walks across the country in communities large and small. So from the point of view of a game-changing strategy, these walks have been enormously effective in creating what is the beginning of a nationwide suicide prevention movement. We track our organization's success by many different metrics. One is the impact of our research. We have funded research into the use of specialized talk therapy, proven to be effective with inner-city youth who have made a suicide attempt to prevent further attempts. We have funded studies that have tested the use of lithium as an anti-suicidal medical treatment. From pilot data collected through our funded study, a researcher now has a larger National Institute of Mental Health grant to study this further. We've studied biological changes in the brain of those who are depressed and suicidal as compared to those who are depressed and not suicidal. And we've funded prevention studies investigating interventions such as the effectiveness of bridge barriers to stop suicide from bridges to the impact of bullying on vulnerable youth. These are all very important funded studies that have led to outcomes that are very important for suicide prevention. Another way we track our success is according to AFSP board-adopted goals and objectives. For example, One of our goals is to create a nationwide network of chapters, and we measure our success each year based on how many chapters we charter and how well those chapters are doing based on their annual work plans. We measure things like how many colleges are using our interactive screening program, how many high schools are using our More Than Sad educational program on teen depression, and the impact of the use of these programs. We also track how many teachers we are training in suicide prevention, how many volunteer advocates we've recruited and trained, and the number of visits they make to legislators to educate them about suicide prevention. Another area of our work is providing support to surviving family and friends who've lost a loved one to suicide. So we measure our impact by tracking how many survivors are attending our Survivors of Suicide Day healing conferences, how many are receiving outreach visits, and how many new support groups have we started? And are these programs having the desired effect? Are they helpful to those bereaved by suicide? So every year we have measurable objectives for each program that helps us measure our impact and helps us revise existing programs or create new ones to meet unmet needs. And yet another area where we have measurable objectives, which is important to donors, is how much we spend on fundraising and management compared to how much we spend on research and programs. I'm pleased to report that we consistently spend approximately 84 cents of every dollar on our research and programs, which is well above industry standards. Efficiency and good governance are important to us, and we consistently meet all criteria of the Better Business Bureau for nonprofit good governance. There are many things about suicide prevention that are not common knowledge, and there are many myths about suicide, as well as misinformation surrounding why suicide occurs. These misconceptions affect the work of our organization and create challenges as we try to combat this leading cause of death. One example is that historically, people often thought of suicide as the result of personal weakness or a character flaw, and even as some type of selfish behavior. And that's a myth. We know from research that 90% of those who die by suicide have a diagnosable mental disorder at the time of their death, most often depression or bipolar illness, but also problems with substance and alcohol use, anxiety disorders, and even eating disorders have been associated with suicide. These are real illnesses, and just like with any other illnesses, they need understanding, compassion, and treatment. So suicide isn't the result of weakness or some personal failing. It's the fatal complication of illness. The more that we educate the public about this simple fact, the more we can reduce the discrimination and stigma that surrounds mental disorders and remove a major barrier to getting those at risk identified and into the treatment that can save their lives. And once you understand that suicide is the complication of illness, then the families left behind begin to realize that it's not their fault. Seeing suicide as the result of a brain illness makes it easier for those who are personally touched by it, either by having made a suicide attempt or having lost someone, to talk more openly about it, just like with cancer, which was also once misunderstood or not talked about. Overcoming this one myth could make an enormous difference. Another fact that isn't common knowledge is that there is an organization like AFSP. Most people don't learn of our organization until they've had a loss or are already concerned about someone at risk. We want the public to be more aware of AFSP and about the information that exists on our website, on everything from causes to warning signs to prevention and resources for surviving family and friends. And there is information for the media about safe and responsible reporting on suicide, as well as information for primary care physicians, mental health professionals, medical students, and others. It is not well known that this information is readily available and that it could be critical in saving a life. One of AFSP's most important accomplishments is that we've had great success in building a suicide prevention movement with hundreds of thousands of concerned and actively involved individuals. This didn't exist until very recently. We believe that this growing movement provides hope for the future, especially as it fuels a level of investment in the research, education, and advocacy that has helped our country address other leading causes of death like HIV/AIDS, heart disease, and cancer. Specifically, when it comes to research, our organization has been successful in stimulating new research, in investing in innovative studies that show great promise, and by attracting the best and brightest young investigators to begin working in suicide prevention research. We have also been successful in our efforts to educate the public and create awareness about suicide prevention through developing new scientifically reviewed programs such as our creative More Than SAD program on teen depression for use in high schools. More Than SAD is now considered an evidence-based program that is being used in high schools across the country. It presents teens with a realistic picture of depression in order to help them recognize it in themselves or their peers, and to encourage help seeking. We are also developing a new innovative toolkit that is available free online for school systems to use when there is a suicide within the school community. Other examples of our accomplishments include development of a successful program for use in medical schools aimed at educating future physicians about depression to help them recognize it in themselves, as doctors have a high rate of suicide, as well as in their fellow physicians and in future patients. I would add that we have been successful in creating policies and legislation at the state and federal levels aimed at anti-bullying, prevention of military and veteran suicide, and on youth suicide prevention, while also creating more political will through recruiting and training volunteer field advocates in every state and across all U.S. congressional districts. In the late 1990s, AFSP established the Survivors of Suicide Day, which includes healing conferences that take place every year on the Saturday before Thanksgiving, to provide information and support to the recently bereaved. There are now hundreds of such healing conferences annually, and the program is also available for viewing on the AFSP website that day and for viewing during the year, all for free. This day has also begun to reach an international audience, with countries participating around the globe. This program has grown so much that we renamed it International Survivors of Suicide Day in 2010. Another major accomplishment that is important to note is that we've created the first ever national network of chapters. These are locally based organizations that are organized and chartered by AFSP and work day in and day out in their own communities, delivering programs, raising awareness, providing support to survivors, and creating a grassroots advocacy effort to begin to address the problem of suicide in their own communities. The historical challenge is to change how we understand suicide. We need to understand that the families and friends left behind aren't at fault, and that the person who dies by suicide has an underlying mental disorder, and that with early identification and aggressive treatment, we can save many more lives. These are the things that historically we have not talked about, so beginning to talk about them will help overcome the challenge of not keeping suicide a secret. We have to begin to see suicide as a major public health problem that can be addressed. Another challenge is that we haven't had the investment in the science that has been there for cancer, heart disease, diabetes, and other leading causes of death. This has left suicide prevention way behind other health-related causes, and is likely because of stigma, neglect, and even discrimination. This is starting to change, which gives us hope for the future. If we had significantly more resources, we would expand our investment in research, and it would give us far better interventions and treatments. We need improvements in clinical care, and we need to be able to better screen and predict who is at greatest risk, even at imminent risk for taking their own life. Long term, it is only through a larger investment in research that we will ultimately save many more lives. If we had more financial resources, we would also invest in more clinical training and in developing better tools for the clinician working with suicidal patients. We would expand our interactive screening program to many more colleges and beyond colleges for use in the workplace, where it could work with employee assistance programs. Because of its confidential and interactive features, it could help identify employees with problems that put them at risk for suicide and help them to get the help that they need. We know from research that if suicide is reported in ways that are graphic or sensational, or if news stories discuss methods, it carries heightened risk of copycat suicides, especially among young people who are already vulnerable. AFSP helped to create consensus recommendations on reporting on suicide that now need to be available to far more journalists and reporters. If we had more resources, working with the media would be a high priority. With more resources, we could also expand our advocacy efforts. We have a good presence in Washington, D.C., but we need to increase our presence in state capitals. Suicide takes a terrible toll on surviving families and friends, classmates, coworkers, and communities. With more resources, we would invest in finding better ways to assist survivors of suicide loss. We need to know more about how survivors grieve and what kinds of additional services and interventions will be of help. These are all areas that would advance our work and where we would invest if we had greater financial resources. When it comes to gaps, I believe the need for clinical training is a major one. To have better training for clinicians working with suicidal patients and more effective interventions and treatments are critical. I also think more access to screening for risk factors for suicide, as well as improved screening techniques, are gaps that need to be closed. Another gap that comes to mind is better family education. Many families after losing a loved one tell us that they just didn't know what to look for, or that they had no idea that their loved one was thinking about suicide. However, as they learned more about warning signs, they realized they were there, but they just didn't know what to look for. The same is true about friends and family, especially among teens and college-age adults. By far, the biggest gap is in research. We need to understand the brain much better and to be able to literally see someday who is at risk through an easy-to-use clinical test. Likewise, we need to see much faster which medications and psychotherapies are working or not working, and we need more effective treatments that are developed specifically for use with suicidal patients.